creating cultural awareness and understanding. This is Culture Clique. Culture Clique is written and produced by KQAL FM on the campus of Winona State University.
Winona has a lot to offer in the way of unique experiences. There are many outdoor opportunities involving the bluffs and river, a thriving arts and music scene, and festivals ranging from Shakespeare to Beethoven to bluegrass. But did you know that Winona has many options for health and wellness that might be considered outside the norm for many people? There are practitioners in Winona that offer everything from herbal medicine to acupuncture to gong baths. That's right, from plants to needles to gongs. Oh my! Recently, there was a healthcare fair showcasing some of the different options available here in Winona, so this summer on Culture Clique, we will be highlighting a few of those options in order to shed some light and hopefully answer some questions folks might be having about these unique offerings. I'm Max Hackman, and here's KQAL's Brylee Harris with Dr. Arrieta of Integrative Healthcare today on Culture Clique.
Today on Culture Clique, I talked with Doctor Arrieta from Integrative Healthcare of Winona. She talks about the difference between traditional and holistic medicine, the benefits of choosing integrative healthcare, and how people can learn more information. I'm Brylee Harris. Stick around to learn more about Integrative Healthcare of Winona from Dr. Arrieta today on Culture Clique. I am here talking on the phone today with Dr. Arrieta, and would you be able to explain more about what Integrative Healthcare of Winona is all about?
Integrative Healthcare Winona is a clinic in Winona that combines the allopathic medicine or Western-type medicine that people tend to be used to with evidence-based alternative practice. And so that's the foundation of integrative medicine. But we also practice functional medicine as well, which gets to the root of the problem and a lot more nutrition-based treatment. So when you come to our clinic, we have a whole range of different ways to treat the individual patient, right? Whether that's pharmaceutical medications or supplements or herbals or IV therapies, etc. But we want to provide a whole range of opportunities for you to continue on your wellness journey.
So I noticed on the website it mentions traditional and holistic approaches to medicine. Would you be able to explain the difference between those two, or is it kind of what you already just mentioned?
Sure, yeah. It's a little bit of what I talked about, but more of the, I guess, traditional medicine practice, right? You go to see a physician and you talk to them maybe about headaches. And if they're migraines, you might have a couple of tests done, but you're most likely going to leave with a prescription for medication for preventing and treating migraines, right? What's nice about that is the health insurance that you most likely carry will cover some portion of that prescription cost. On the other hand, some people don't like taking prescriptions or want another approach, and that's where the integrative side, right, or the holistic side will take part. And we talk a little bit about your nutrition, right, because headaches can come from food sensitivities, or is it a nutritional deficiency, such as magnesium deficiency or vitamin D, or are we having just increased inflammation, and what is that from? What is the root cause of that? So it teases it out a little bit more, and we're able to formulate a treatment plan around your needs and want for that holistic care, whether that's a mind-body approach, right? We talk about mindful breathing, decreasing your stress levels, meditating, helping with your sleep, which sometimes can trigger your migraines. Is it, again, supplements, essential oils? Do we want to talk about other options as well that might be triggering your headaches, and so we can treat it at the root cause? So those are kind of the different approaches, but what's nice about the clinic is that we offer both. And so some people will pick and choose, and it just puts more tools in our toolbox to help each individual patient.
Oh, okay, yeah. So then what are the various services that you offer at Integrative Healthcare?
Sure. So right now we have some patients, we have a certain stock of supplements and herbals and vitamins, et cetera, that patients can purchase from us. We have some patients that come in for pain neutralization technique for their chronic pain. We have some patients that are familiar with frequency-specific microcurrents. And currently we have a new addition, which is IV nutritional therapy and IV ozone. So some patients are requiring higher levels of vitamins, and maybe their GI system is not absorbing them as well. And if they were to get a higher dose of vitamins through the IV, it bypasses that GI system and makes them feel a little bit better for a little bit longer. So that's a new service that we've now included. And the IV ozone is fantastic for things like chronic fatigue, chronic illness, helps with kind of oxygen utilization at the cellular level. So it really helps for a broad range of illness and diseases.
So then, are there like specific instances where you would recommend a patient more a holistic or traditional approach to the medicine that they're receiving, or is it just totally up to the person and what their preferences are?
Yep, a lot of it is patient preference. I can speak to, the individual and ask, what are your, concerns? What do you want? And then we, as a team, work together with the specific individualized treatment plan for them, right? So some of my patients like the idea, let's say, right, we're sticking with the migraines, they like the idea of maybe having an abortive medications that they can take if they ever have a migraine, but they also use a lot of the other alternative practices, if you will, to help prevent migraines. So that's a nice combo. Some patients come in and say, I just, want to talk about the alternative holistic side of things, and I really am dissuaded, away from traditional medicine, and so we definitely go that approach. So I definitely take every individual patient's preference in mind.
Yeah, and that kind of, I guess, is like similar to the question I was going to ask, but do you feel that there are any specific benefits to using an integrative approach, or again, just kind of being able to have like a variety of options?
Right. So I like the variety of options, but I think that using integrative medicine as both a preventive tool, so we can get to the root of the issue, right, and help prevent, let's say, the symptoms that you're having, but also treat the underlying issues, whether that's inflammation, right, or food sensitivity, so we can hopefully prevent any other symptoms from having place, right? So if we can prevent your migraines, then we don't necessarily have to treat your migraines because you shouldn't be having any in the first place, if that makes sense. So that's why I like the kind of twofold approach.
Can you kind of give us a backstory on how you got into doing more of an integrative approach to medicine or healthcare?
Yeah. So I started, I went to med school at Texas Tech, and I was very lucky in that when I was probably my first, 1 to 2 years, I was kind of like, okay, this is okay. I know I want to be a physician, but this is not the type of medicine that I actually foresee myself practicing. I want a little bit more. And there were actually integrative medicine physicians at Texas Tech, and that took me under their wings and really mentored me and showed me that there was a whole other avenue, and really encouraged me to continue learning. So I stayed there for my residency, doing both my allopathic in family medicine care, but also the integrative and functional medicine in family care as well. And after I graduated residency, I did a 2-year fellowship in integrative medicine as I've continued doing my functional medicine certification as well. So that kind of leads me to here, right? I was very lucky in the fact that I knew kind of what I was wanting and what I was missing in my training, and I found it almost immediately. Not a lot of the other integrative physicians or providers are that lucky, and they really have to kind of struggle through traditional medicine, all the hoops and loops that come with it, and then they try and figure out, right, integrative and functional medicine is available to me, and I'd really like to learn and train from it. So I was very lucky in that I've been practicing this for so many years.
Yeah. What then would you say is your favorite part about practicing integrative healthcare or just integrative healthcare in general?
Sure. So I think it's just seeing my patients get better and feel better and know that they're coming in and we're actually treating the underlying cause of so many of their symptoms and not just, let's say, putting a Band-Aid on their symptoms and making their symptoms feel better, right? So if they're having, knee pain, we really want to get to the understanding of why are you having knee pain, right? Is it an autoimmune issue? Are you flaring? Are you actually sensitive to gluten, which can cause joint pain? Or is it something more nefarious, right? Do you have tick-borne illness or another infection kind of in the joints that we also need to be made aware of?
So seeing my patients get better definitely keeps me going, right? And keeps my practice open and fulfills me in the way that I still want to stay in medicine.
Yeah, definitely. Do you, like, working in integrative healthcare, do you notice that people hold any reservations against the different approaches, or is it kind of just people are open to anything really when they come to you?
Yeah, I think they're definitely more open, right? Because the patients that seek me out are already looking for a different opportunity to approach their health, right? They might have already seen other providers. They might have had, their primary care physician, and they're looking for, again, what is that other thing, right? What is the alternative? What are my other options? And I provide that, right? If we want to talk about your nutrition, or we talk about your sleep health, or do you have metabolic issues? Are you chronically fatigued? Why? What's happening? How can we get you feeling better? So the patients that walk in the door or even call the clinic are already primed, I think, and looking for other avenues, if you will.
So then, where are people able to go to learn more information about Integrative Healthcare of Winona and the services that you offer?
Sure. So I have two websites going at one time, so that's a little confusing, but they look very similar. One is integrativewinona.com, and the other one is soleintegrative.com. Soleil is my first name, so it's SOLEIL, integrative.com. And both will talk about the services I have at the clinic, our clinic hours, our phone numbers, our email addresses, etc. But our phone number is 507-457-9000, or you can shoot us an email at info at integrativewinona.com.
Awesome. Well, I don't think I have any more questions. If there was anything else you wanted to add?
No, I think that was great. I'm super excited to talk about my passion in integrative medicine. So if anyone wants, to follow up with any questions, definitely reach out. We'd love to hear from you, and we are in the community.
Awesome. Well, thank you so much for taking the time to talk to me today about Integrative Healthcare of Winona.
Perfect. Thank you for having me.
Thanks again to Dr. Arrieta for sharing more about Integrative Healthcare of Winona and the benefits that it can bring today on Culture Clique. For more information, visit her website, integrativewinona.com. To keep up on all things Winona and the surrounding area, tune into Culture Clique Thursdays at 12:30 right here on 89.5 KQAL. I'm Brylee Harris, and we've been talking all about Integrative Healthcare of Winona today on Culture Clique.
Creating cultural awareness and understanding. You've been listening to Culture Clique. Support for Culture Clique is made possible by the Minnesota Arts and Cultural Heritage Fund. Culture Clique is produced by KQAL FM on the campus of Winona State University. For more information, look us up on the web at kqal.org. And thanks for listening to Culture Clique.